Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us. Our guest is Tracy Warren. She's CEO of the only precision medicine company using software and predictive analytics to improve outcomes during the first 1,000 days of life. Welcome to the program, Tracy.
Thank you, Neil.
You're the CEO of Astarte Medical, a precision medicine company. Have you always been into medicine? Are you a medical professional by trade?
Actually, my background is more on the finance side. I was a venture capitalist for about the last 18 years, along with my co-founder, Tammy Jansen. It was actually 4 years ago that we met the healthcare catalyst for this, which is Kate Gregory. She's a newborn ICU nurse and a researcher up at Harvard working in preterm infant microbiome and nutrition. So Kate's really our in-house medical resident. Tammy and I bring more of the business and finance experience.
Now, you say your company is using software and predictive analytics to improve outcomes during the first 1,000 days, well, that 3 years old. What is it about the preterm infants that makes them so susceptible to gut health issues?
Sure. Well, and the first 1,000 days really, and this really starts at conception through age 2. It's a window of opportunity where proper nutrition can help improve both growth, physical growth, brain development, and long-term health outcomes. For our premature infant population, which is our first market within that first 1,000 days, the reality is we're surviving infants as early as 22-week gestation. So if you can imagine, just halfway through a pregnancy. But we're really, clinicians are struggling to help them thrive and to develop. 50% have growth failure, 40% neurodevelopmental disability. And so with our software, we can use data, machine learning, and analytics to start to help create information about the state of the gut, which is your largest organ of immunity and really very critical in both growth and brain development.
Being critical in both growth and brain development in that first 1,000 days of life, what are we supposed to do in order to maximize the health of the gut in our babies?
Sure. I think there's probably two kind of tools in the toolbox for clinicians. One is getting better information or real-time feedback about the state of that gut. So host response, right? So as you feed a child early in life, many of these children are fed by a tube. They're too young to suck and swallow. That practice of feeding is very difficult. It has a lot of fits and starts to it. It's very difficult to know if you're feeding too much or too little. And so our software will enable quantification of the gut, much like a vital sign you have for the heart or the lungs, but it'll be really targeted at the state of that gut, knowing if it's moving towards an inflammatory response. The other thing that our software will do is help to titrate the use of things like antibiotics. So if antibiotics wipe out your gut, if you've taken them as an adult, you know that. And so early in our babies, we're trying to help be better stewards of antibiotics for very obvious reasons, and perhaps use that same tool to then use things like probiotics or prebiotics to help microbially stimulate that environment to improve its state and help with that growth and development.
Now, using software and PA, how is the determination made about the state of the gut in the infant?
Yeah, so we've built the world's largest data set using shotgun metagenomic sequencing. So we are part of the Illumina accelerator. Illumina is the world's largest sequencing company. And we generated thousands and thousands of samples around microbiome for preemies. And we use that coupled with electronic medical record data to create an algorithm. And so that algorithm functions by recognizing factors in the medical record about the baby. So this is stuff collected as part of routine care, and it creates that score based on those factors. And the way we know that score is sort of correct or true is that we have all of the sequence data sitting behind it in our data set.
Is there any sampling done with the parents of the patient based on the condition of the gut? Is there anything that you can glean from the parents to maybe predict the outcome and maybe change it?
We do no sampling with the parents, but we do take data, maternal data. So there's been plenty of research that shows that maternal factors, age, weight, whether or not mom had an infection, and some other sort of symptoms or comorbidities, whether she had antibiotics or steroids during labor. Those have all been well researched as microbial risk factors for the baby. So we do collect that maternal data from the medical record, but there's no physical sampling of the parents or the baby in the clinic. All the sampling has been done in building the algorithm.
Now, you're talking about tube feeding, premature birth. The baby is in distress. You treat the baby based on the condition of the gut, based on your predictive analytics. So the baby survives. What about when the baby goes home? What about the future, the coming weeks in the hospital?
No, it's a great question. We're starting initially in the clinic because for two reasons. One is there's a high amount of high fidelity data because it's collected. As you can imagine, everything about these babies from before they exit the uterus is collected. So it's a very rich data environment. We do, as a company, plan to expand beyond the clinic. So both those preterm infants that go home, as well as term infants, so healthy term infants that go home, and looking at early infant nutrition, or to again help create the healthiest microbial environment. So NICUtrition is our platform name, and we have 3 products that we're developing. The first 2 are around enteral feeding. So this is that tube feeding that I referenced for our tiniest babies born under 34 weeks gestation. And then our flagship product is our gut health score. This is the one that we spoke about previously that really helps to quantify the state of that gut. And so we have a portfolio of products within the NICUtrition platform. The first 2 around enteral feeding will launch this year. Our gut health score is it's the one that we're continuing to develop. We will do a study to clinically validate its effectiveness, but it really helps to empower clinical teams to have better information and make better decisions as it relates to feeding, the type of nutrition, as well as antibiotics and probiotics.
Where can our listeners go online and get some more information about Astarte Medical?
Sure, we're at www.astartemedical.com. Our new website is launching in a couple weeks, but there's some good stuff on there today.
Great. Tracy, been a pleasure this morning. Thanks for joining us on the program.
Thank you so much for your time, Neil. Take care.
You too. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.